and but yet we lost him.
Yeah, I mean, it's sad. Is one of our past leaders, immediate past president. What I believe, I think going to London to get treatment, I think for some reasons, some of the treatments that he could, he could benefit from are not available in the country, and that's why he had to go. And, being the first person in the country as at then, we have to give him the best. And I think we should treat the situation like that. He has to enjoy the best. That's what I think. But generally, it's sad that we lost him. But I think he's 82. He died
That's
at
to say
82.
that you were in support. You were in support, or you are in support of the going abroad for treatment, especially for our for leaders.
I don't have a problem with it. I think going abroad for treatment, of course, not just for political leaders, even people that are not into politics go abroad for treatment, and a lot of people can afford.
Why I made mention of political leaders is these are the people who are to create development in the state, in the country. These are the people who have the sole responsibility of making sure that things are done rightly, things are fixed. The health sector should work, the financial sector should work, the oil and gas sector should work, the road network should also be good. So that's what I'm saying. That are you also of the school of thought that, well, man, as a leader, yes, you should have the best. You should go for medical treatment abroad instead of fixing one. Yeah,
I don't have a problem with people going abroad for treatment. I would say that they should take a cue from what they see abroad and bring it home to translate it here.
All right.
That should be the good side. Yes, there's the issue of the poor health infrastructure, which,
of course,
we are part of.
Strike every time.
Lack of motivation.
Strike from NAD every time.
Yes, there's a lot of lack of motivation from the health workers, and all these are fueling the brain drain. All right. So at the moment, we have a lot of paucity of, health workers, doctors, specialists, because a lot of people are moving abroad because they believe that they have a better system, which is correct. All right. But, it's important for us to look at, for the leaders who have the opportunity to go abroad for those treatments, to take a cue and bring it back home and translate the same thing.
Dr. Ademola,
we should learn. Yes.
Let me hold you there for a bit. Let's listen to a word from Femi Adesina, and then we'll come back and we'll take your reactions on that. It's still on these conversations about doing right, fixing things up. We're still talking about health sector here. Let's listen to him, and then we'll come back. Don't forget, Nigerians, we're live on YouTube at Super FM Lagos. We're live on YouTube at Super FM Lagos. Let's listen to the words of Femi Adesina.
Contrary to what many people believed, he was not a religious bigot. And then discipline. We needed to know how disciplined President Buhari was a stickler for time. I guess that came from his military background. He was disciplined, and it was one of the things I admired in him. And of course, integrity. You cannot accuse President Buhari of anything that has the slightest affinity to corruption. I know the next question will be, so many people around him have been accused of corruption. But the thing is, you cannot link President Buhari with corruption in any way. Not in any way.
Well, Femi Adesina said that if the president was treated in Nigeria, he would have long been dead. What does this interpret to you in the health sector?
It's unfortunate he said that, but at the same time, it's true because we don't have the infrastructure. We have personnel that are trained, well trained, but if you have personnel without infrastructure, we can't get things done. What I expect, I mean, based on their travels, going back and forth abroad for treatment, I mean, to be able to take it, for them to be able to take a cue from what they see there and translate it here. All right. The kind of treatment it could have gone for could have been a high-profile treatment that may not maybe only be available for 1 to 2% of the population in Nigeria. So let me give you an example. For prostate cancer, they do what we call robotic surgery. That's Da Vinci. And if you look at it,
that sounds like
robotic surgery is available. Are you with me?
Yes. When you made the word Da Vinci, that sounds like an outside word or something.
Yeah, just like Da Vinci Code.
Okay.
All right. So it's AI driven actually. Okay. So the robotic surgery actually for prostate cancer will give you the same results with the open surgery or a laparoscopic surgery that are available here in the country. The only thing is that the shorter time to that you spend in the hospital, all right, and that makes a lot of difference for a lot of people. So that is available in the abroad. Does not mean that we have to. I mean, every state have to have a robotic surgery. We need to focus on making available the basic resources, health resources to the general populace, rather than focusing on a small minority that will benefit from highfalutin. And that's the reason why I don't have any problem with people going abroad for treatment. They have a right to go get treatment for their health. They are Nigerians just like us, but it's important for them, based on the oaths they have taken, to do their best. Based on their ability to be able to take a cue, learn from what they are seeing there, and they bring it back home. I mean, we've seen in the last 2 years in this administration, we've seen a number of transformations that has occurred in this administration. We've seen it in the healthcare sector, where, I mean, even though President Trump has withdrawn aid from Nigeria and some other African countries, the government is able to actually sit down with the governor and say, oh, let's put together some funds and make it available so that these drugs could be locally made and it will be cheaper for the people. I mean, look at the area of HIV and AIDS, tuberculosis. Those drugs are actually usually imported, and you know that over dependency on the West has actually, I mean, eaten deep. And you know, there's a lot of money to be used, but people don't know how to use it because they get many of these drugs from abroad. But now there's a lot that, I mean, there's no money again, and there's a lot of accountability that needs to be given. And so people are actually sitting up. And you know, if you look at it in the health sector, the Ministry of Health has actually focused on developing the primary health care, which I believe is the basis for universal health care coverage in the country. And a lot of things have been done, although, I mean, considering what has been done to what is expected, we are not there yet. But I mean, they've taken off with a lot of traction. I think that they're we're running with a good momentum at the moment. So basically, I don't have a problem with people going abroad for treatment. They have a right. They are humans and they are Nigerians. They have a right. But what I expect them to do, based on the oaths they are taking, is to be able to go there, see what is there, and see how they can translate it even into lower technologies here, and so that people can access it at affordable and affordable rates. That's what I think.
All right, thank you very much. Well, let's hop on the man to Lagos. You can be part of this conversation right here on Spotlght and Super FM 92.7. Call us 0705 690 0927. 0705 690 0927. Let's take your comments on all of this conversation right here. Or call us on 0802 0802 502 7711. 0802 502 7711. You can also call 0705 6900 927. 0705 900 927. Health, they say, is wealth. Well, you can send us a message via WhatsApp on 0705 900 927. 0705 900 927. That's for WhatsApp messages. Okay, let's come back to conversation. Still talking about the health, right? Yeah. Well, how do you measure health status? How do you tend to measure your health status?
So basically, I think we need to first of all know what health is. Health is not just the absence of disease, but a state of physical, mental, emotional, spiritual, social well-being. So, I mean, if somebody is physically well, all right, but is not mentally or emotionally well, then we need to actually provide help in that area. So there are so many things that are wrong. I mean, you see, average Nigeria may be healthy, but I mean, there are a lot of pressures that are causing mental effect on people that are making them to actually manifest in some ways. So people go through bouts of depression based on disappointments or challenges from financial issues and all that. So that is still part of health because is impacting, and in fact if depression sustained for a while affects and impacts on the immune system and translates into so many things in the body. So
that reminds me, talking about depression, I heard, I don't know how true is it, that regular exercise is therapy for depression.
Yeah, of course. Depression comes with a lot of symptoms, and one of them is low mood. Right. So if you engage in physical exercise, the only reason why you engage in physical exercise is because you have motivation. So it's a way of healing also. So it has a long way.
So it is the motivation that cures or that helps to heal the what did I call it now? Not just the exercise.
So it's not going to take care of the depression, of course, but it's going to help with the symptoms. At least the person may actually pull out of that episode of depression at that moment. Although the problem that is causing the depression may still be there, unless the problem is taken away. The depression doesn't go. But if you look beyond the problem and then also look at the symptoms, I think a way exercise has a way of helping to pull out of that episode.
Wow, interesting. Still talking about health care. How do you can one maintain health status? Some will say, well, I don't have money, so I can't definitely do all of this routine. So how can one maintain a good health status?
There's no way you can maintain a good health status without money. All right. But I think
what about the use of all these herbs?
Herbs are good, all right. But the problem is that when you have a herb that works for everything,
it's dangerous.
There's probably no truth in that.
Dr. Oyekan, I must say you've not maybe it's been long you entered Molue. When you enter Molue, you know that there's one medicine that can cure everything.
Yeah, so absolutely, there's no truth in that. Saying that there's only one medicine takes care of all illnesses, herbs. So basically, and the other thing is the measure of dose. So basically, when people are ill and they're asked to take one Ademola or the other, they take it based on how the symptom is. So they can actually take a lot of overdose that will impact on their liver and their kidneys, because these are the things that are actually processing these drugs. The drugs shouldn't last long in the body. If you take too much of it, it can impact on the kidneys or the bladder, or or the liver and could cause problems for the person. So basically, it's important to know that these things actually should they have a role. I don't have a problem with herbs generally. I believe that it could be put to proper use. With a lot of evidence. The Chinese people are doing a lot with their ginseng, and I believe that a lot can also be done with herbs for us here.
How about the use of all these natural, I don't know how they call it, seeds? Well, sometimes you go into, I'm talking about for Nigerians, for Lagos, because when you go to creeks, you hear that, there is this thing that was brought from so place where somebody died, or there's this leaf that was brought from so place where one particular god died. Or there's this, different thing that's been said. And sometimes when I come across all of this, I wonder, is this really benefiting to the health? Is this really good to the health? You know how some Nigerians can be. They'll bring something from somewhere. They say, they traveled to Jerusalem and this was given to them. And so therefore, this is very, very good. Just when you have cancer and when you have a particular generational health, this is what you should use. And it's very good for the health. What do you advise in regards to all of this?
Well, the truth is God has blessed us with a lot of things in the nature. There are a lot of leaves, herbs that actually have a lot of health benefits that we're still discovering. But discovering them and putting them to good use is what is important. When you discover something, it should pass through test, experiment it in animals before you translate it to humans. And that's what we call clinical trials.
Which we don't know if it was done.
Yes. So if you have not done this, you cannot categorically say that, this has done this. It could work in the person, does not mean it's going to work in the general population. It could be coincidental that, when you use this, that's when the symptoms are getting better. I don't have a problem with, just like I said earlier, I don't have a problem with herbs, but to say that this herb work for this without a proof, and that's where we should be driving towards. Going towards the clinical trials, looking at the herbs that are available and what they can do, and looking at them in the labs. And funny enough, we have a lot of brains in this country, people that actually have the ability to actually translate some of these things. But the wherewithal and the trust in our system. Nigerians don't trust Nigerian practitioners, whether health or other paramedicals. So the trust in what we produce is lacking, and then we believe more in what is brought from abroad, whether it's Turkey or China or India, than what is done here.
Yeah, I must tell that. Yes, Lagos, don't forget, call us and be part of this conversation. Or probably you have a question. Probably a challenge you want to ask. So we have a consultant right here who will do justice to your health status. Well, call us 0705 690 0927. 0705 690 0927. Hello, good morning. Hello, good morning.
Good morning, Comrade Shogunle, speaking for Aito Italy.
All right, Comrade Shogunle, please make your comment.
Doctor, you are welcome into the house. After hearing your submissions, your projections, and your analysis on this orthodox medicine, and you said most of the orthodox medicine they are even passing through tests. You cannot actually ascertain it for people to use. How will we know that the orthodox medicine is right? Or all this NAFDAC, they pass through NAFDAC because you can use it. This is what I'm after.
All right, thank you very much. Doctor, I hope you got the question.
Look, can you help me take that again?
All right, you were saying all of this orthodox medicine, some probably without NAFDAC number, somehow you said you also made it, you also reiterated on how it should go through some processes before it's being used by humans. So he said, how sure can they all of those things should go through processes?
All right. So thank you. I think in medicine, there is what we call the pharmacodynamics and pharmacokinetics. And it has to do with how the drug moves when it's taken into the body, and how it moves from the mouth into the organs and all that, and how it's flushed out eventually. And all these are important. It helps us to know what dose is safe that can, treat whatever condition it is. So if you say you want to use a particular herbal medication, what dose is safe? What dose of the active ingredient is safe? You need to know. And if you don't know this, it's not going to pass through the NAFDAC. It's not going to pass the NAFDAC test, because those are questions they're going to ask you. And that's the reason why you see that it's only a few of these herbal medications that actually processed into sachets that's actually passed through. I don't want to mention names of some of these, but you see them, something 1,000, you see them that they pass through NAFDAC test for them to get approval. But a lot of others do not have NAFDAC approval because they don't have a measured dose. All right. And the way people use these drugs, they use it based on how intense the symptoms or whatever they're going through is. So basically they use it like that. So it's a thing of, testing the safety and the efficacy. Safety is how safe is it for your body, and the efficacy is the dose that is measured is going to tackle what is supposed to tackle over the period that is meant to. So those are questions that is going to be asked. And how genuine is it? Those are things that will be asked at NAFDAC. And if they don't pass through it, there's no way they're going to get an approval.
Yes, Lagos. Keep your question coming in. You can also send them via WhatsApp 0705 6900 927. 0705 6900 927. You can also call us via that number. Hello, good morning. Okay, please call the other number 0802 502 7711. Call us on the other line 0802 502 7711 or 0802 978 8003. 0802 978 8003. Don't forget, you can send a WhatsApp messages to 0705 6900 927. Hello, good morning. Hello, good morning. Okay, we have some glitches there. Call the other line. Please call us on the other line 0802 502 7711. 0802 502 7711 or 0802 978 8003. 0802 978 8003. Well, okay, doctor, this is an important question. Some Nigerians don't even know what really is cancer. What is cancer? When you go and they say, oh, don't do this, don't do that to avoid cancer. What really is cancer?
Yeah, so basically cancer is an abnormal growth of cells. Abnormal group of cells whose growth is uncontrolled, uncoordinated, and then they can even continue to develop in the absence of what initially triggered them. So basically, that's what the cancer is. It's like somebody that has lost control. All right? It continues to divide. What triggered them initially, even if it has been removed, the cells will continue to grow. So that's what cancer is.
Is there a cure for cancer? Because sometimes the mention of that name, cancer, can even, kill a human. So, is there a cure for
Yeah,
it? And how do
basically,
you know?
at
How
the
can one
moment,
know that you have cancer?
well, I mean, let me start by saying that a number of cancers can be um, known if only you have done maybe a biopsy to find out. And it's when a cancer shows up in a part of the body that you can visibly see, that you can pick on time, and then you can take sample and send to the lab for tests to know what the nature is. Sometimes that the cancer are in hidden parts of the body that by the time it's showing up, it's already advanced. By the time it's showing symptoms, the disease is already advanced. So it's quite difficult, and that's the reason why we are saying that we've known a number of cancers that are common in our population: breast cancer, prostate cancer, colon cancer, liver cancer. They are common in our population, and there are screening modalities for it. So you're not going to have to start looking for symptoms. Rather, you can go in for a check. For breast cancer, one can have a mammogram done if you're above 40. All right. If you're less than 40 and you have a family history of cancer, you can be doing yearly ultrasound scan of the breast. You can also do a self-breast examination. I mean, if you check your Google, you see ways, or YouTube, you see ways to do self-breast examination to just pick out lumps both in the breast.
So basically, breast cancer is hereditary.
Well, it's only about 10 to
cancer in
20%
general.
of
Are they
breast
hereditary?
cancer. I wouldn't say
Because
so.
why I'm saying this, in
addition,
why I'm saying this, because I've heard of cases where they say, oh, diabetes, anybody who has diabetes, then definitely check in their lineage that is hereditary. That diabetes just don't, especially when one dies of diabetes, that is always hereditary. You know, probably there's traces of someone who has diabetes in the family. So all of this, just to enlighten Nigerians, please expatiate.
Yeah, so I mean, that's where I'm coming to. So there's no one disease it has just one cause. It's an interplay of so many causes most of the time. So there's a role genetics play, which is familial or hereditary. There are a lot of roles that the environmental exposure also play. That's exposure to pollution, to radiation, and all that. And there's a lot of role that lifestyle of a person also play. One of these factors can actually overrun the others at some points, but most often time is an interplay of a number of these factors. So for breast cancer generally, it's just about 10 to 20% of people who come down with breast cancer have a genetic predisposition to it. And the fact that somebody has a genetic predisposition to it does not mean that they're going to come down with the cancer. So it's important to know that, and it's important to also know that there's a lot of role that the lifestyle and the environmental factor also play.
Well, okay, I got a message here. I said, good morning, Mr. Inyang. I appreciate your program and the contributions of your guest. My question is this. Still on the issue of trust within the Nigerian populace, the test result of a medical ailment that a certain hospital got from a patient whom they could not treat for certain reasons are usually discarded by a new hospital who will insist on fresh tests. I guess I understand where she's going to now. In most cases, the results are usually identical with the ones from the referring hospital. Money is usually lost in the process. What can we do to help this situation? Okay, Preston. Preston, you didn't put where you're sending the message from, but I said Preston. All right. Doctor, I come to understand what this person is saying. sometimes they'll say, okay, go and do a test. You've done a test, and then they're referring you to another hospital, and then the hospital you're being referred to is still saying you should go and do a fresh test again, all of this. And then, before you know it, millions of naira is spent. What's your advice to patients like this?
Yeah, I think it's still based on the issue of trust and within the healthcare sector. As much as we have a lot of brilliant and very hardworking and passionate healthcare workers, I mean, there are a number of maybe organization or labs or hospital who sometimes, I mean, very small percentage cook up results. So it's important to look into that carefully. And sometimes you want to get a second opinion. Two eyes are better than one. If somebody says this is what it is, so this person does has a breast lump, and you take a sample from the breast lump, and they say, oh, it's a cancer. And the first thing is the person will say, no, that's not my portion. I'm going to have another test done. And you don't want to also discourage that. So you would oblige and say, okay, let's have another test done. And sometimes it could be the other way around. You see something that looks obviously like a cancer, all right, clinically, and the test result is telling you that it is not. You have to retake that sample. Sometimes expertise could be the issue, all right, or maybe not paying attention, or it could even be mixed up in terms of results. So those are challenges that are human errors that could happen in any organization, in anywhere in the world. So even in America, they can have those challenges. In Europe, they can have those challenges. So human error is unavoidable. And when they say, "Oh, let's have a recheck," it's okay. But if it's obvious, I mean, if what you're seeing correlates with what is seen on the lab result, there's no need to have a repeat for that.
Okay, Preston, I believe that has done justice to your question. Okay, so good morning, Ebullient Anchor. So please ask the guest, doctor, the relationship between cancer and prostate disorders. Isaac Ndukwe. All right, Isaac from Lagos. Good morning. It says, please ask the guest doctor the relationship between cancer and prostate disorders.
All right. So basically, I think what you need to know about prostate, prostate gland is a gland that is just above just below the bladder, and is one of the vital organs in the body, helps to secrete part of the constituents of the semen. The urethra, that's a pipe that carries urine from the bladder, passes through the prostate gland. And as we grow older as men, every decade, maybe from 25 and above, every decade, the prostate gland increases in size by a portion. Depending on the kind of family you come from or the heredity, determines how.
That means there's so many things that are. Sorry to comment. That means there's so many things that are attached to hereditary.
Of course. Yeah. So it depends. So it determines how quickly the prostate gland grows. So somebody that is in his 60s or 70s may have an enlarged prostate gland, all right? And you can see also somebody that is maybe 70 or 80 and still has a normal-sized prostate gland. So there's no one size fits all, and that's the reason why, that's where hereditary comes in. So as the prostate gets bigger, it can narrow that pipe that carries urine from the bladder. And when that pipe is narrowed, it can cause problems with passing urine. So we call that benign prostate hyperplasia, where part of the prostate is enlarged and is causing narrowing of that part. And that's entirely different from cancer. Most often time, there is a coexistence of this benign prostate hyperplasia with prostate cancer, or benign prostate hyperplasia existing alone, or prostate cancer existing alone. So the risk factors for prostate cancer, I mean, it increases with age. I mean, it's more common in Africans. Africans are known to have a higher concentration of testosterone level, so it's more common in them. So and so many other factors. I mean, it increases the risk, the genetics. There are a number of genes that are actually responsible.
Could it be the reason why an adult still wets the bed at night?
Yes. So yes, it's possible. The benign prostate hyperplasia, you see somebody pressed, and before they stand up to get to the toilet, the urgency of wanting to pass the urine and they couldn't control it could make them weigh on themselves. So that could be an issue. And you see some people, they'll get to the toilet and they want to wee, and they are waiting for the wee to come. And they can wait for maybe 5-10 minutes. And because of that, they lose sleep. All right. And it can actually cause their blood pressure to be raised eventually. So,
well, Lagos, I'm sure you're taking out something from this conversation right here today. Join us. You can also be part of this conversation right here. Or probably you have comments or questions you want to put out to a consultant right here on Super FM 92.7 on Spotlght. 0705 690 0927. 0705 690 0927. That's the number to call or send a WhatsApp message. 0705 0705 6900 927. 0705 6900 927. Call the number or send us a WhatsApp message. You can also call 0802 0802 502 7711. 0802 502 7711. The second line is 0802 978 8003. 0802 978 8003. Okay, right, Doctor, I still want to put out this. In Nigeria, cancer leads to about over 79,542 deaths per annum. Well, they say those who've lost for male, about 32,905. Those who've lost for female are more, about 46,637. Why is this? Is it more for female? That's one. And also in 2024, there were a record that about 400,200 cases of cancer within 5 years. Don't we need a succor?
Don't we need
a help? Don't you need a help? Don't you need a succor?
Yeah, I mean, of course we need the help. We need all the help that we can get. The burden is increasing. I think one of the reasons is because of this adoption of the Western lifestyle. If you look at it, that's the reason why I said earlier that it's not just genetics, it's an interplay. You'd leave your house, maybe air-conditioned house in the morning, move into an air-conditioned car, move into air-conditioned office.
So you're saying too much of air condition is unhealthy?
No, that's not the issue. But I'm talking about the sedentary lifestyle.
Okay.
All right. I mean, I'm just emphasizing, and that's the goal of everyone. All right. You just want to enjoy life. All right. But I mean, it comes at a risk. Our forefathers used to walk from this place to that place. But, people will say, oh, where do we have opportunity to do that, to jog in the morning, safety, security, and all that? But, I mean, those are some of the things that we need to adopt to make sure that we get opportunity to if you have to just get something, you don't have to take your car. You can take a walk. All right. Some of these little things adds up in terms of exercise, adds up to make a lot of difference. I'd say that one major cause of many cancers is obesity. And if you look at average Nigeria, yes, we have moved from under nutrition to overweight and obesity.
All right, let's quickly take this call. Let's quickly take this call. Hello, good morning.
Yeah.
Hello, good morning.
Yes, good morning. What's the name and where are you calling from?
My name is Dami. I'm calling from Badagry.
Dami, from where?
From Badagry.
From Badagry. Dami, please make your comment.
Yeah, please, I want to ask the doctor a question.
Go ahead, please.
I've heard from some people that if a man has been having sex before, then stopped like a very long period of time, he did not have sex, that it could lead to prostate cancer, something like that. Please, I want to confirm, is it true?
So the question, if I could rephrase, is if not having sex will predispose to cancer.
Cancer, yes.
Right?
Yes. For a long time.
So there is no evidence. There is no evidence that says that if you don't have sex, it will reduce your risk of prostate cancer. Where there is evidence is if a man is castrated. All right? That means the person they've removed the testicles. Removing the testicles can reduce the risk of prostate cancer, but you are not going to use a machine gun to kill a mosquito, will you?
No. Exactly not.
Yeah. All right. So basically, I think that answers the question.
Okay. All right. Thank you very much for that. Then finally, because we're running out of time right now, can you recognize cancer in human? The warning signs of cancer.
All right. So basically, it depends on the part of the body, but the common thing to most of them is significant loss of weight. Loss of weight in a very short time without intentional fasting would be a sign. But apart from that, if you look at various parts of the body that could be accessible, the breast, checking for lump, or if you notice a lump in the breast, you should find out what it is. You notice an abnormal discharge from the breast or an abnormal lump in the armpit. Those are early signs that you could actually use to know if there's something wrong. For colon cancer, if you notice your poo is black, all right, but most often time is not every time that is going to come in that manifestation. If you notice that you're passing a colored poo, it could be an indication that's probably you're bleeding from somewhere. It could be from the stomach or from the colon. And sometimes if you notice blood in your poo, it could be a sign for colon cancer. All right. Then for prostate cancer, there's probably no sign. It could come with other signs of benign prostate hyperplasia.
No
but
sign.
It's important.
Wow.
Yes. So it could come with other signs like benign prostate hyperplasia, like frequency, going to toilet often, hesitancy. That means you get to toilet and you're not having anything come out, or you are not able to control wee. All right. Those are some of things that it could come up with, but it's not specific to prostate. It could happen in both in prostate cancer and benign prostate hyperplasia. But then, doing a PSA, yearly PSA would help from age of 40 or 50 and above would help to pick up if there's anything wrong. Apart from that, any abnormal swelling in any part of the body should be checked out. All right? Go check it out. You see people with lumps on their neck and they're not checking it out. They're just carrying it around. You see people with lumps or probably on their forehead or on their back. Go and check it out.
Lumps on their neck. Is it the one they call elephantiasis?
On the neck.
On the neck. Okay. I think the one on the leg is elephantiasis, I guess.
Yeah, so elephantiasis could be elephantiasis, which could be as a result of the infection or the infestation, all right? But it could also be as a result of other things, other conditions. It could be as a result of heart failure, it could be as a result of liver failure, or it could be as a result of cancer. All right, so it's not everything that is swelling that is always cancer. And I mean, you need to also, but it's just to create an awareness that if you notice anything, I mean, it's appropriate to go to the hospital, not a pharmacy, not go to a proper hospital. Is important, not advice from relatives. And, you know, it's important to know that even though relatives have your best interest, even if they are medical people or professionals, they advise you with bias, right? They advise you with the mindset that, oh, along with definitely see somebody like this. You understand what I'm saying?
Yes. Wow, it's really been a lot. I've digested a lot. Yeah, Nigerians, negotiations, I hope you have too. I hope you have taken a lot out of this conversation. Dr. Ademola Oyekan, radiation and clinical oncology consultant. Thank you very much for your time this morning on Spot. Well, sorry, we're really out of time already. So much to talk about. We talk about your health. Health is wealth. Please take good care of yourself, Nigerians, Lagosians. Please always, like the doctor said, at least once a year, make sure you go for regular checkup. Thank you very much, Dr. Oyekan, for your time this morning on Spotlight.
Yeah, thank you for having me. Thank you, Nigeria.
All right, Lagos, this is where we draw the curtain right here on Spotlight.